Welcome to an episode of Hot Topics in Cosmetic Medicine. As you all know, my name is Dr. Anthony Youn, and we do this once every month to 6 weeks, where I'm joined by my good friend, dermatologist, Dr. Emily Levin, and we'll introduce her in just a second. And we're going to talk all about hot topics in cosmetic medicine today. So today we're going to talk about some pretty interesting things. We're going to talk about myths about filler that we should talk about more, 7 beauty treatments that you may regret getting years later. We'll also be talking about Elocore, which is a billed as a non-surgical facelift. That sounds good for a lot of people. And the Labia puff. What is the Labia puff? Okay, so let me introduce my guest this week. She's been on the podcast for many months now, Dr. Emily Levin. Welcome.
Thank you.
So Dr. Emily Levin is a board-certified dermatologist. I know many of you who listen to our podcast regularly know who Dr. Emily Levin is, but if you don't know and you haven't heard this podcast, The Hot Topics, can you tell us a bit about yourself, your background, and where you practice and all that stuff?
Yeah. So hi, everyone. I've been on here pretty much monthly. So hello to all of those of you that know me. But those of you that don't, I am Dr. Emily Levin, and I am in private practice, a board-certified dermatologist in the suburbs of Detroit, Michigan, which is in Southeast Michigan. I have a private practice where I practice mainly, general dermatology, cosmetic dermatology. I have a medical spa, and I do a lot of surgical dermatology, excisions of skin cancers and such. And I've been practicing for almost 25 years.
Good deal. So we always start off with some kind of personal things. How have you been? Everything going well in your life?
Everything is going well. I've got, my oldest kid is in college, a freshman in college, as is yours, because our children are very good friends. Yeah. And then I have a second one about to go to college next year, and then one starting high school. So it's...
Yeah, it's going to be tough. You're not an empty nester yet, but You'll be 2 out of 3. You'll have on the coop. That's tough.
I can't. I think the youngest one's going to have the hardest time because he's going to get all the attention and be very lonely without his brother and sister. But that's about all that's new with me.
Well, last time that we chatted, one of the things that we talked about was my journey with rosacea. And I had a lot of people comment on it and give me advice and all this stuff. And so when we talked, this was probably about 6 weeks ago, I had talked about how I had started myself on very low dose doxycycline. And we talked about this 4-in-1 rosacea cream that you have at your office. And so I did use this low dose doxycycline. I've done a lot of things to try to improve my rosacea, and none of it was working, which used to work all the time. And so I finally went to your 4-in-1 anti-rosacea cream, and I've been using it now for probably the last 2 weeks, maybe, and it definitely is better.
Good.
I would say I'm probably 40 to 50% improved, which I've been pretty happy with.
I am so happy to hear that. I'm so happy and not surprised, because I'm telling you this, they actually just also are making a 5-in-1 now. They added one new ingredient.
Oh, 5-in-1.
So they just found that there's another ingredient that's stable if you mix it with these other 4. And so they added that. So if and when some people, that extra ingredient can sometimes cause some side effects. So, we usually start people on the 4-in-1 and then maybe move up to the 5-in-1 when you're done with that bottle. And then if you have any side effects, we'll bump you back down to the 4-in-1. But
interesting.
For the most part, I'm happy to hear it's doing well. And in 2 weeks, that's great, because...
Oh, it usually takes longer?
I usually tell people give it like 8 weeks to see if it's making a difference. So if you're already noticing improvement in 2 weeks, that's awesome.
No, it's definitely... it's not gone, but I'd say 40 to 50%. A lot of times I'll wake up in the morning and I hardly see it at all. And then I apply the stuff and then I start messing with my face, and I see it pop up a bit more.
It does flare a little. And if you do flare up, Tony, you can use it twice a day, actually.
Oh,
so
really?
I usually tell patients
I am using it twice a day.
Yeah, okay, you can use it twice a day initially. At night, I usually do twice a day the first month, then drop it down to once a day as prevention. And then if you have a little flare up, you can bump it up to twice a day for the flare and back down to once a day.
So if you have a patient come in, new patient, they've got rosacea, they've got it on the cheeks, they say, look, I don't know what my triggers are. What can you do to help me? What would be like your starting treatment for somebody who's got it and maybe it's fairly new onset? How would you start them off?
Literally with this exact cream.
Oh, really?
What I love about this cream is it's the 4 different prescription topicals that are just, we had a pharmacy formulate into one for us. So they have no side effects, except that added 5th one now has a little bit of some potential side effects, but the 4-in-1 has literally 0 side effects. And I love it. We used to prescribe one, or then a second one, then a third one, then a 4th one. They became very expensive. A lot of insurances don't cover treatment for rosacea. They consider it cosmetic. So when we found a pharmacy that could mix them all for us in a certain stable way, I start everybody on this. I talk to them about avoiding particular triggers, which are common. There are certain ones that are common triggers for everyone, and then there are some that are specific to some people, and we talk that through. And then we talk a little bit about laser, because the BBL laser, which is a great workhorse for us, really can help rosacea as well.
Interesting.
No cream is going to take away the blood vessels once they deposit, the little capillaries that you see from rosacea. But if you can catch it before those really solidify in your skin, the cream works wonders, prevents it from getting worse. I start everyone on that cream.
And I mean, I picked it up a couple weeks ago.
Yeah.
You pay cash for it. It wasn't that expensive, but I don't know if you gave me a discount or if that's the regular price.
I did not give you a discount.
Because it
Sorry
was
to
like
tell you.
$60
I should have given
or
you
$65 or
not a
something, which
discount.
really is not. I mean, that's not bad at all for
So-
something that's a prescription strength cream.
Correct.
That's like custom formulated and all of that. I'm surprised. You should raise the price on that.
Yeah, well.
But don't until after our listeners
I was
come
gonna say.
and visit your office, and there you go.
So I will say, interestingly, we've had a lot of people call because they heard me talk about it on this podcast.
Oh, really?
And we do telemedicine visits, and we are happy to do that. It is, it is a prescription. So we can't just sell it without having an office visit and diagnosing you. Of course, you have to be diagnosed appropriately with rosacea, because there are many other conditions like lupus that can mimic rosacea. And we always want to make sure we're giving you the appropriate treatment. So we've had a lot of people call and have been doing a lot of telemedicine visits, or
good.
people have just been coming in to see us, which is great.
Right, too many rosacea patients.
Yeah,
Stop
a lot of
talking
people
about it.
suffer from it,
Yeah.
and it was so. I'm glad you brought it up, because a lot of people suffer, don't know what it is. They think they just have sensitive, flushy skin, but that's a condition with rosacea, and there is a great 4-in-1 or 5-in-1 cream that helps a lot.
Yeah, no, I mean, I'm proof of it because I've been, so I haven't had issues with it for years, and then probably 4 or 5 years at least. And then just in the last 6 months, it has popped up, and I have tried the normal things that I do with changing diet and all this stuff, and nothing was helping it, and it was getting worse and worse and worse. And then I had these TV appearances that I was coming in for, one of them for GMA, Good Morning America, their third hour, and I emailed them ahead of time. I'm like, look, I need a makeup person because my rosacea is like really bad. You don't want me to just show up and like, hey, let's talk about your skin, and like, what's wrong with that guy's skin? And so even for that, like, it's like, oh yeah, let's get the makeup artist to, kind of powder him up a bit so that you're not seeing it so much.
Yeah.
But now I'm feeling, like I said, probably about a 40 to 50% improvement.
I mean, in 2 weeks.
Realistically, and in 2 weeks. So
I'm
I've been
so
very
happy to hear
with
that. And keep me posted, because I think it's going to get
definitely.
even better.
Yeah.
So after you use this bottle, if you're getting better and better, but you want to move up to the next one and try the next one, when this bottle runs out, let me know. We'll do the 5-in-1 just to try it.
Cool.
It's got one added anti-redness ingredient to it. So
Cool.
Yeah.
All right. So the first article that we're going to cover is from one of my favorite websites, Mind Body Green. And this is an article that's basically 3 myths about filler that we should talk about more from a derm. So these are 3 common myths busted by London-based dermatologist Amna Adel, MD. Myth number 1, filler only lasts a few years max. The general life of hyaluronic acid filler is 6 months to a couple of years. Adel explains in a TikTok video that some hyaluronic acid filler can last up to 12 years after it's been injected, as seen on MRI. Have you heard this 12 years?
no, I have not. And I clicked on that MRI just to take a look at it. And those MRIs only went out like 24, 27 months. Okay. So they just note that in the study. They didn't actually show any MRIs that were indicative of that, but I have never heard that and certainly not experienced it in my clinical practice.
Are you seeing patients who've had filler that, we get filler and then they pretty much will tell us, so the studies show, for example, that Voluma can last upwards of 2 years, like Juvederm Ultra Plus, maybe up to a year.
Yep.
Have you seen patients who appear to have exceeded that time frame by like several years?
So I find this really interesting because I've been doing fillers for literally 20 years now. And I will tell you, Tony, that it's not about the filler, it's about the area. And some areas, it lasts longer than others, no matter the filler. So, I do a lot of cheeks. Sometimes I do the nasolabial folds and what we call the marionette lines, which are those, scowly things there. Those are bottomless pits sometimes, and those do fade very quickly, the 9 months, a year. The cheeks also last about a year or 2, depending on the product you're using. The tear troughs, where we inject under the eyes, and the lips are 2 areas that, and even from personal experience, because I inject my own lips, The filler in my lips lasts like 3 years. It's amazing.
Really?
Now the catch is that I'm not doing a biopsy of myself to like see if the filler's still there, right? That's the only way you really know. But as you know, your body builds collagen and hyaluronic acid around the filler. It stimulates your own body's response for collagen and hyaluronic acid. So the question is it your body's response that you're just making all that extra collagen, that it looks like the filler's lasting that long? We don't really know how long the filler is there, but I will just tell you that, I inject really thin fillers in the tear troughs. It's a tough area to treat.
What's your favorite filler for that area?
It depends. Restylane L is my favorite right now. I've done
basic Restylane.
It's basic Restylane L. Yeah. It's got good, that G prime. It holds like its shape, but doesn't seem to cause too much swelling. I used to use a lot of Volbella, but for some reason I'm really liking the Restylane products right now. So I kind of switched over. Restylane L is my favorite. I will inject someone's tear troughs and 5 years later, they still look great.
Yeah.
And I don't know why that is, because I know the filler's not possibly still there. So did it stimulate, a response? And then I have others that come in every 6 months that, for other areas.
I think the filler still is there.
Could be.
Because I've had patients, so I don't inject under the eyes, but I agree with you. The area that seems to last the longest are the tear troughs.
Yeah.
And I had one patient many years ago who came in with puffiness under her eyes from her tear trough injections. And she said, look, I had these done like 5 years ago, and now I don't know what's going on because they're still puffy and I don't like it. And she said, so I went and saw my doctor and they said, well, filler's gone. This is not that, it's something else. And I said, let's try this. And so I injected hyaluronidase, which is the enzyme that melts away filler, as you and I know. And a week later, she came back and it was gone.
Awesome.
And her lumps were gone. And it was like filler from literally 4 to 5 years before that.
Yeah.
The thing that I would disagree with you on here is usually I see that the lips don't last as long as the other areas.
Interesting.
So do you routinely see in your patients that the lips last that long?
Yes, I definitely, no question about it. The lips, for some reason, last much longer than expected, in my opinion.
Interesting. Yeah, that's funny, because that's exactly the opposite of what I've found. I've always found that the lips will last 6 to 12 months, and then the other areas like the cheeks and, tear troughs is a long time, seem to last longer. Yeah. And I just always assume because the lips are so mobile, there's like a high metabolic rate to them, that it would kind of eat up that filler quicker than if it's just like sitting on your chin or sitting on your cheekbone or something like that. But
it's so interesting. I can't, I don't know why. I have noticed that the lips last a long time, both on myself and on my patients, but the cheeks and those other areas fade sometimes even faster than, you would expect them to. And everybody's different. Everybody's metabolism is different. And then you also have the, balance of how quickly someone's aging. So it's like, unless you are actually doing an MRI or doing a biopsy to see if it's still there, how do you really know if it's still there, or if there's,
Could be scar tissue.
Yeah, could be.
All right, myth number 2 is you can easily dissolve your filler without downsides. Dermatologists and plastic surgeons use an enzyme called hyaluronidase to break down filler. The catch, it has no way of being able to differentiate the filler from your body's own hyaluronic acid, so it just dissolves it all, Adel says. Unfortunately, it can take months for your body's hyaluronic acid levels to return to normal, she says, which can lead to bumps and dryness. Hyaluronic acid plays a huge role in your skin health. It keeps your cheeks plump, texture smooth, and skin hydrated. You can ingest hyaluronic acid in the form of HA supplements to support its production during the decline, which is a good idea given you're left with half your supply by age 53. So this is something that we don't need to dissolve a lot of our filler, but we usually tell patients that there's not a lot of downsides to using hyaluronidase. According to Dr. Adel, who's a dermatologist, she's saying that it can really it can get rid of a lot of your body's own hyaluronic acid. What is your thoughts on that?
Yeah, I would say that, yes, it certainly can. But I have, like you said, I love the safety profile of hyaluronic acid fillers because you can dissolve them if you have an issue. That being said, I think I've dissolved them maybe 5 times in the 20 years I've been injecting them.
Oh, wow.
And oftentimes it's the tear trough. I think one time I had somebody have a little bit of an allergic reaction, and kind of had a granulomatous reaction, so I dissolved those. But most of the time I haven't. It's very rare to dissolve it. And yeah, your body stimulates makes your own hyaluronic acid, but I haven't noticed the people that I've injected it in have had more sunken or, areas because of it.
I've seen doctors claim that and say, oh, it's not, because we'll say, oh, if you don't like it, then melt it away. And people say, oh, no, you never want to do that because you've got side effects of it breaking down your own HA. I too have never experienced it. We have, because I have 4 injectors here. And so I myself, probably the same as you, have melted hyaluronic acid filler maybe 10 times. But with all my injectors that do it, it's a lot more than that.
Yeah.
Mostly people who come in and they have problems, usually not from here, but they've had issues from
Elsewhere.
somebody else and stuff. And I've never had somebody come back and say, geez, not only did it melt my filler away, but now I've got a dent where it was injected.
Never.
I've never seen it.
I've never seen it.
And I had a patient many years ago, and I did a couple of videos on this, who had an intravascular injection of filler. And I injected, and this was my patient. I did a video on this and years ago, and I injected an insane amount of hyaluronidase into her.
You got to flood it.
Insane amount, and it was fine. And I did a lot of research on it before I did that. Is there a toxic dose of hyaluronidase? And there's just nothing out there.
And she didn't dent or anything. Like you didn't notice any type of. I just had a patient, it's actually a staff member, that had her lips being injected for years and kind of layering one filler over another. And at one point, it was just starting to feel and look lumpy, and she felt like they looked uneven, and she just wanted to start over.
Yeah.
So I injected hyaluronidase, a ton of it, in her lips because it had been years. I'm like, I don't know how much of this is going to be scar tissue and how much I can't predict.
To kind of put it all around.
I
so it can,
flooded her lips.
Exactly.
They went down perfectly to her normal original lip. There was no
nice.
atrophy, and even though I just flooded it, there was no unevenness. It really works. I have not noticed it be an issue.
So that's my feeling too. Like I said, there people will spread online that they're a fear of don't use hyaluronidase. Don't melt the filler away because you'll have an issue. But yeah, I agree with you. I haven't seen any issue.
Yeah, me neither.
Myth number 3, and this is something we've actually talked about, is everyone responds the same to filler. Agree. That is a myth. Not everybody responds the same way. Let's see here. So, and here are 3 quick tips then for supporting full, juicy skin sans filler. Keep your skin deeply moisturized, both inside and out. Prioritize hydration. Layer on the serums, creams, and oils to protect your complexion from losing water and prematurely sagging or wrinkling. Agree. Prioritize protein. A diet rich in protein can help support tighter, firmer skin from within. Agree.
And antioxidants. I'm adding antioxidants. Agree.
Yep. Try retinol serum or upgrade your current regimen. Retinol thickens the lower layers of the skin while thinning out the top layer, the stratum corneum, which creates a dewy glow. Do you feel, just question for you, we're big fans of retinol. Do you think any other topical cream increases collagen or thickens the skin or improves crepey skin more than retinol?
No.
Nothing.
I don't. I think, like you said, layering on everything, the more hydrated, the more serums, growth factor, all the things we've talked about, the peptides, they can all help a little bit, but on their own, solo monotherapy, retinol is still the best. And it has the most research to show.
Yeah.
Proven research. So and that's the one I would never go without myself.
Okay.
Yeah, and sunscreen.
Fair enough. Okay, this next article is from Real Simple, and it's 7 beauty treatments you may regret getting years later. So these are basically 7 treatments that they're recommending that you think twice before you do it. The first one is microblading. They explain what microblading is. Hopefully you all know what that is. This is semi-permanent brow tattoos, been very popular for maybe a decade or so. And they say that poor work can result in blurring, fading, and uneven color. Also, like traditional tattoos, microblading can turn bluish gray versus staying brown. Whether the work is good or subpar, you'll also need to do routine maintenance. So as a dermatologist, Dr. Levin, do you discourage your patients from getting microblading like this article is saying, that you may regret it years later?
On the contrary, I recommend it for people that have alopecia or have thinning of their eyebrows. I get it done myself and have been getting it done for years. But I do notice that you do have to have upkeep with it, like anything else, just like hair color. I consider it like hair color. You get your grays covered and you have to keep upkeep of that. I have had it done, and when I first get mine done, and I have brown eyebrows, they look amazing, and they're brown, and they look exactly the shade of my hair, and she does an amazing job. And then all of a sudden, I don't know, 9 months later, a year later, my kids were like, Mom, your eyebrows are purple. Why are they gray and blue and purple? And I'm like, they took pictures of these lovely pictures, as our kids do for us, of this close-up of my eyebrow, and it looked bluey purple. So as it was fading, it was doing that. So I went right back, she fixed, she redid them. You have to have tune-up treatments. I still think it looks so natural, and I think they can make them look wispy. Your eyebrows look really natural. And now they're doing it for eyeliner. They do it for lips. Like they're microblading, semi-permanent tattooing. I would never recommend the permanent tattooing, which is what used to be prior to microblading, because your face changes shape.
Yeah.
And then you see, unfortunately, some elderly ladies or older ladies that have their eyebrows tattooed up high or lower, and it's falling into there. So the semi-permanent tattooing, I think, is great.
Does that go away then eventually?
Eventually, it will fade. It unfortunately turns to a color that's not the original color they put on first.
Yeah.
I've noticed that bluish, purpley gray discoloration.
Do you think that and I don't know if you have experience with this, but do you think you can use a tattoo removal laser then to get rid of that pigment if somebody says, hey, look, I don't like it and I don't want to wait for it all to fade?
You absolutely could, except as we know with permanent tattoo removal lasers, you could obviously, if you do have any hair left, it's probably going to get rid of that hair.
Oh, that's right.
And then you never know how the scar can look uneven. But yeah, technically a good hair removal laser could, but then I still have hair there. I just get them in between, to fill them in and make them look thicker and so on.
Yeah.
And the original color stays for a while. It's just when they start to fade 9 months a year, I have to get them redone.
I had a patient of mine, sweetest woman, and I did a facelift on her. And I mean, just the sweetest woman ever. She looked great, but she had permanent makeup like that woman from the Drew Carey show, where it was like clown makeup. Like it was just like bizarre, bright, like fluorescent-y type colors. And I thought that it was just makeup that she just put on. And when we did her surgery and I'm washing her face off, I'm like, oh my gosh, this is permanent.
Did it move when you did her facelift? Like, did it relocate?
No, it was fine because it was like under eyes, it was lips.
Okay, liners
and it was and it was like I think blush, and then she had it even like all like her eye makeup. It was like all purplish pink and stuff like between her eyelid and her brow. And I thought that it was that she just applied it every day. And as I'm cleaning her face off to do her facelift, I'm like, oh my gosh, this is not washing off. She has this permanently. And I mean, I don't know. God bless her. I think she was happy with how she looked, but she literally looked like, I don't remember that woman's name, but that Drew Carey show where that woman had
Right,
this,
I don't remember her name either.
Crazy makeup.
Yeah,
and,
I don't advise the permanent, but the semi-permanent for a small area like microblading, I think it's great. I do it. I recommend it to my patients they're more distraught from having thin or no eyebrows.
Yeah.
And so it gives them confidence back without, with something that's eventually will fade or you can keep getting redone.
Do you see a lot of people in your practice who overplucked their brows during that time in the early 2000s, maybe, where they were like, everybody had these pencil thin eyebrows and stuff?
Sperm brows, they call them. Sperm brows. They were like a little thicker here and then went really, really thin. And they called them sperm brows. I had them.
Do you see a lot of people who now they're dealing with the consequences of that?
Yep. And they want to let their brows grow out.
Yeah.
They ask about like Latisse, which is the eyelash growing product, and they try that on their brows. Sometimes works on brows, sometimes doesn't usually. And then they ask about what else can they do, and I say microblading.
Yeah.
Which is great. Works great. I actually think it's I'm thankful for it because I think it's helped thicken my brows and just it gives me a little more confidence in not having to put makeup on my brows. You just got to keep up with it. So my kids don't tell me I have purple brows.
So this is one of the 7 beauty treatments, according to Real Simple magazine, you may regret getting years later. Microblading, according to Dr. Levin, board-certified dermatologist, don't believe it.
But
so
go to someone good.
Go
to someone good.
Yes.
Because if you have to go somewhere reputable or else they will mess up the color. I've seen that before too.
All right. Second beauty treatment you may regret getting years later is chemical hair straightening. There's quite a lot of evidence, they say, of evidence to suggest that permanent hair straightening can cause serious hair damage. Some potential risks include dry hair that leads to breakage and possible hair loss. So as a dermatologist who deals with a lot of patients who've got hair-related issues, do you agree with them that you should consider not doing chemical hair straightening? You may regret that years later.
I do. There is a ton of research on this, and I have also in clinical practice, there was a hair clinic where I trained, and so I have a ton of training, and I probably see, as I was saying, 5 to 10 patients a day that have hair thinning, hair loss, hair breakage. And, a lot of it's age-related, but a lot of it isn't. And a lot of it can be from early years or long-term practices of either chemical straightening, perms, tight hairstyles can do a lot of thinning of the hair. So tight hairstyles, chemical straightening, high heat. And I'm not talking blow drying. I'm talking like hair pressing, things like that. Can really cause significant damage over time and lead to significant hair thinning later in life. So I really counsel my patients to avoid harsh chemicals on the scalp. Interestingly, hair color, which is another obviously big industry, they have not shown can cause any major damage. So that is the interesting one I find, that they have not, people that have colored, they've done retrospective studies.
Even if you color for like decades?
Even if you color for decades, it does not thin the hair. But the real tight hairstyles, tight pulling and, on the hair, like tight braids, things like that. And then the harsh chemicals, perms, even like no-lie perm, all kinds of perms and chemical straighteners, and then the high heat pressing can really accumulation over years.
So even hair coloring even over the year, you're not going to cause your hair to get brittle and all that.
The studies show that it does not
Really?
cause issues with hair.
Interesting.
Yeah.
I'll have to tell my wife that because she was under the impression that it did.
Not hair color. They've done study. It's interesting. There's something about the color that doesn't seem to damage the follicles the way that the other ones do.
I once considered hair straightening, believe it or not. Yes, I'm Asian. And when I was in residency and I was in a band, I grew my hair out to the point where it was like shoulder length almost. And it was straight all the way up until basically my jawline, and then it curved up like a little Debbie type of a thing. And so then it went down and then curved up all the way around.
We need to see a picture, Dr. Youn.
And I thought, I need to straighten this part because it's curving up and it looks like I'm like a kindergarten age girl.
So you blow it out. You get a Dyson or whatever, the fancy hair dryer.
This was like 20 years ago. Yeah, we didn't have that back then. So I thought maybe I got to straighten this thing. And so instead what I would ended up doing is just cutting it before it curved up like I said, like a school-age girl. And now when mine grows out, it gets more wavy. I don't know, I've gotten older and it changes. It's changed. So
it does. Hair texture, and it does. A lot of people's hair texture changes as they get older, but yeah.
All right, so another beauty treatment you may regret getting years later are permanent threads or sutures. Whether it's a facelift or rhinoplasty or just a thread lift, one thing is for certain. If you have a permanent suture at some point, it may pop up years later, causing a problem. There's really no advantage to putting a permanent suture in, and if you have any sort of infection, which is very likely for almost all of us, these stitches can work their way out in the form of abscesses and other issues. So do you agree that permanent threads or sutures are a bad idea and you may regret it years later?
I do. I mean, again, we've seen side effects. People have come in. I don't do the thread lifting or any of the permanent or even dissolvable, lifts, the thread lifts. But as we've talked about, I think in another podcast, I have seen people that get puckering, and they get just some uneven texture when it starts to fall and isn't, they don't last long anyway.
Yeah.
But I don't think putting anything permanent in your face. I mean, I don't know. Do you do a lot of like implants in the face, chin implants, lip implants? I've seen that and I wonder, how do those go over time? Do people regret those?
It all depends. So I do a decent amount of chin implants, a lot less than I used to just because of filler being so useful now.
Yep.
Lip implants I think are a terrible idea. I've never seen a lip implant that I thought looked good. For a while, initially the lip implants, they've tried all different things. Gore-Tex for a while. People were doing Gore-Tex on the lips, and Gore-Tex is thick. Like, your jacket can be made of Gore-Tex. Like, you don't want to put that in your lips. Yeah. So the problem with permanent implants in the lips is they always look fake and they always look stiff. They're even making a saline implant that you would put. It's like a outer silicone shell with saline on the inside, and they put that into lips. And like, how's that going to look natural?
I don't know.
And then the other thing that was very common for a while is alloderm, is cadaver skin.
Yeah.
You put alloderm in the lips and that would last for a couple of years for some people, but none of it, I'm not a fan of any of that.
Me neither.
One thing, I do a lot of facelifts and I use one permanent suture on each side to basically prevent what's called a pixie ear deformity, where the earlobe pulls down. And so I put a permanent suture between the skin of the earlobe and basically the perichondrium, the covering of the cartilage of the ear. And that tends to prevent that pixie ear deformity. And I've never seen that stitch be a problem. But I know a lot of people that will put deep stitches all throughout the face, and it just doesn't make me comfortable about leaving all of that foreign body in there.
Correct.
So I use all absorbable stitches otherwise. And I don't know long term if maybe the muscle layer that you tighten may loosen a little faster. But for me, you wanted things to kind of relax and settle anyway, and you don't want something to stay like super tight,
right?
Because it's just not going to look natural as the skin over top then droops. So
I agree. I'm not a fan of any permanent. I guess the word permanent is probably just off my table.
There you go.
For treatment.
All right, so the next one is chin lipo. It only works in rare few cases, and often getting rid of the fat between the skin and the muscle is not going to improve the look of your neck, says Daniel Gold, a board-certified plastic surgeon in Beverly Hills, California. I know Daniel, nice guy. In addition to removing softness and potentially aging you, he adds that these devices can also create scar tissue between the skin and the muscle below, which can result in visible bands and nodules. You see a lot of patients who've had chin lipo. What are your thoughts on that?
I haven't. I was going to ask you that question. I mean, we do cool sculpting on the chin, to debulk the area, but it doesn't usually.
Find that works?
It helps a little bit. It definitely helps for a certain, the right candidate. It definitely helps. Not going to be nearly as dramatic as lipo, but I'm curious if you see, because I've done a lot of chin lipo over the last 20 years. I've almost never seen an issue with it. So
I like Dan. Dan's a nice guy. I would disagree with him on this, that
Yeah.
I don't think it's something that people really regret, unless you're just the wrong patient. Unless you're doing
Correct.
it on the wrong patient,
Yeah.
it's not a good candidate, then that's a different story.
When you do lipo under the chin, Tony, do you usually also do a little lift with do you have to lift the skin, or do you find it tightens once they?
It depends.
The skin
So
itself.
I typically chin lipo is kind of like the weekend neck lift. And that is best in somebody who has good skin quality. And so you basically defat it, and then the skin will retract to an extent.
Okay.
So it's going to come down to quality of the skin, which a lot of that, you can kind of look at the age of the person and know how they're going to do. So anybody under the age of about our age, so anybody like less than, let's say, early to mid 50s, usually that works pretty well. But once you hit the early to mid 50s, the skin laxity, the looseness starts taking over, and it's usually not successful to lipo underneath the chin if the skin is loose.
Yeah.
Because then you're going to potentially see the skin get looser afterwards.
Right, and almost hang or sag,
and potentially
yeah.
hang. So,
Okay.
So usually the best candidate is somebody in their 20s, 30s, maybe 40s, and they've got kind of a double chin that maybe they inherited, and they just want to get rid of it. And those patients love it.
Yeah.
So I don't know if I've ever had, sometimes you get like a little unevenness or something like that. But other than that, I've never had somebody come in and say, oh, I never should have done this.
Yeah, good. I mean, I see a lot of people that have had lipo all over their body, and I rarely see, I don't do lipo, but I see follow-ups from people that do, or, I see a lot of complications from people that get a lot of procedures, but I rarely see complications from liposuction anywhere. It seems like a real effective procedure.
Okay, so the next one that is a procedure that they recommend that they say you will regret getting years later is exfoliating too frequently. Stick to a balanced routine with gentle exfoliation no more than 2 to 3 times a week. And make sure to pair your regimen with ultra-hydrating formulas and barrier-repairing ingredients like ceramides and niacinamide. Do you often have patients come in and you go, what are you doing? You're exfoliating way too frequently?
Sometimes. I mean, usually it's a self-limiting situation, because if they're exfoliating too much, they're getting raw and irritated, and so they realize they're exfoliating too much. But I do recommend exfoliating once or twice a week. I personally do a chemical exfoliation myself, whether it's a chemical peel or I use like a glycolic acid cream at night a couple days a week. And then I have like the little micro beaded, product as well that I usually do once a week. So I'm usually twice a week I'm exfoliating, but if my skin feels irritated, I back off. And I think most patients know to do that.
I have a nurse I was working with today, Cheryl. Nice gal, older woman, and really intelligent. And she was telling me today that she does a 35% TCA peel on herself.
How often?
I'm not sure how often, but
Ouch.
she's like, and she was peeling today. She works in where I operate, and like 35% on yourself. And I said, where did you get that? She goes, oh, you can buy this stuff whenever you want it. And I'm
Really?
like, oh my gosh, you're doing that to yourself. Yeah.
You could burn yourself very badly with a 35%
I know.
TCA.
I know.
For those of you listening,
don't do that.
Don't
This is
do that
something-
on your
this
own.
is
Go to a
something-
professional.
So that's what you should put. Instead of, we'll take out chin lipo and 7 beauty treatments you may regret getting years later, TCA 35% peel on yourself.
Yes.
So I'll tell you, in my practice, we do a 15 or 20% TCA peel. My esthetician does that, and I oversee them during the whole process because you worry if you get too deep, you can get burns.
Absolutely.
Yeah, and scarring.
Yep.
Okay, the next one that you may regret, we've talked about, so I'm going to skip over, is overdoing it with filler. So we know that that's a bad idea. And then the last one, the last treatment you may regret getting years later is plasma pen treatments. Plasma treatment pens are essentially a small pen-shaped medical device that creates tiny little burns in the skin, usually used around the eyes to simulate a blepharoplasty or an eyelid lift. Have you seen these online?
I almost bought one once. I was so convinced looking at it online, I almost bought one once.
Really?
I did not. And I've had one patient that's had it done, and it's done a little bit of improvement for her. No scarring, but I've only seen one person that's had it done.
It's scary as hell.
Yeah, like little burns.
So yeah,
you
if
could take the cautery machine and just, you could kind of do it.
that's
I feel like, couldn't
exactly.
you do it with just the cautery machine?
So for those of you who are listening and watching and you're like, what is a plasma pen treatment? It's literally like it sounds. It's a tiny little handheld device, looks like a pen. It has a sharp point at the end, and that sharp point basically emits heat. And so what you do is you basically create these tiny burns, And they'll literally, for like an eyelid, they'll burn it maybe 50 tiny little burns in one eyelid. And they'll do the other eyelid the same thing. And the idea is that if you burn the skin in a minor way, like in a fractional type or a pixelated type of a way, then the skin, the skin that's around it that's normal will essentially help heal it. And the idea is that it can cause that skin to tighten up. And so it's similar in idea to like a fractional laser where you're doing these tiny columns of burns into the skin, and the skin around it that's not burned helps the healing process so you don't get scarring and all that. But that's done under the hand of a trained, practitioner, a dermatologist, a plastic surgeon, not something that you literally do at home. Or there's some places that are like spas that are doing, not even med spas, just like spas that people buy this. You can buy these things on like Walmart.
On Amazon. I know. On Amazon. You can, it's scary. And the Fraxel and some of the Pixel and all some of these microneedling and things like that are such teeny tiny, micromillimeter things. This is like if you hold your hand in one spot too long, that's it. Like it's a burn.
You create like a crater in your skin.
Correct. It's real uncontrolled, unregulated-y kind of. It
is a scary treatment. If you see on TikTok or on Instagram, you may see some of these where these tiny little dots all over the face, all over a lot of times it's the eyelids, and just stay away from that. It's it's like putting a 35% TCA peel on your own face. Only Cheryl can do that. She's a nurse. She's been doing it for a long time. She wants to do it, then by all means. But everybody else, I wouldn't do that on myself.
I wouldn't either, and I wouldn't do the plasma pen either.
So the next article here is from New Beauty magazine, and it's why this 78-year-old swears by Elocore for tighter skin. For Janet, the moment of realization came in the form of an unexpected photo. I saw these little jowl things and thought, this isn't happening. No, 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 she recalls. At 78 years old, she knew she wanted a more youthful look but wasn't interested in surgery. So first of all, she just noticed jowls at 78.
Got good genes.
Man, I mean,
or she just had cataract surgery. You know how they just have cataract surgery and then they're like, oh, I got all these wrinkles after cataract surgery. That happens all the time.
I think if you just noticed jowls at 78, I mean, if you had cataract surgery, I get it. But if you haven't and you just started noticing it, dang, you're way ahead of the game. Right. So she said she knew she wanted a more youthful look but wasn't interested in surgery. That's when she discovered Elocore, a minimally invasive treatment that tightens skin. Elocore is an FDA-approved microcoring treatment that removes tiny amounts of skin to stimulate collagen and tighten the face. Unlike lasers, which use heat, Elocore physically removes microcores of skin while keeping the surrounding tissue intact. The result? A firmer, lifted appearance without scarring. You don't feel anything because you're numb, Janet shares. There was no real discomfort. By day 4, I was out and about like normal. There's a doctor who does it, Dr. Waybell, and Dr. Waybell says it's great for anyone experiencing skin laxity, whether you're in your 30s, 40s, or 70s. We even use it on areas like the neck, inner thighs, and elbows. And that's pretty much the gist of the article. Have you heard much about Elocore?
I hadn't. And so when I read this article, I looked it up and I started doing a little research on it. And in all honesty, the before and after pictures were okay. I wasn't super impressed. But it looked a lot like microneedling to me, like the same results as microneedling, which is almost in theory the same. Instead of coring out these little microcores, you're heating these little microcores. So you're destroying the tissue or activating the tissue to stimulate better, newer collagen, whether it's coring it out in little teeny tiny spots or, heating it up.
Yeah.
So I was not, by no means was she's like, oh, I do this and I look like I've had a facelift. I'm like, okay, no, you don't. Look like the jowls were still there. Yeah. I don't know if her eyesight, but and I was not super impressed with the pictures. But there was a little bit of improvement in some of those pictures. Obviously, the younger, more youthful looking skin had more improvement, which is what we find with microneedling as well. But I thought, to me, it didn't seem like some new hot big difference, procedure more so than the radio frequency microneedling, which we get good results with.
Yeah. So, I think the idea of it, when I heard about it, and I've heard about this, maybe a year ago, I thought was really interesting because I do a lot of facelifts. And when I do a facelift, I remove skin, and I may remove literally, a centimeter and a half, 2 centimeters of skin essentially from each side of the face. So you're talking a total of anywhere from 3 to 4 potentially centimeters of actual skin is removed from the face, that much kind of length of skin. And so the idea of this, where you're, instead of creating those, because to do that, we have to create scars.
Yeah.
And scars are lengthy. And so it made sense to me that if you're going to microcore, so essentially what you're doing, this treatment, it's a handheld treatment. You have to numb the area up because essentially you've got these needles that are hollow and they puncture your skin and they're hooked up to suction. And as that punctures your skin and it comes out, it sucks out a tiny core of skin with it. And the idea is that if you do that hundreds of times on the face, each microcore of skin may, be like, 1/100th of a centimeter or something like that. But if you do it 100 times, then the idea is, and maybe you remove a centimeter of skin.
Yep.
And because those cores are so small, the scarring that it will inevitably create is barely noticeable or just not visible at all. And so it really is kind of a cool idea of like, how do you remove skin from the face? And as we get older, our skin sags and we get excess skin. Facelifts cut that skin out. How can you remove that skin without actually cutting it out?
Yep.
And so chemical peels, laser treatments do that by causing the collagen to shrink, by heating it or by affecting it in some way. And this seems to work like surgery. So I thought, that's kind of a cool idea. And man, that sounds great. The issue that I have with it and why I'm not buying it and trying it myself is that if you look at the treatment, it's a bloody freaking mess.
Oh, I didn't see the treatment itself.
It's bloody. Like there's blood everywhere.
Oh, Lord.
Because you're taking needles and you're poking the skin like 100 times or something like that. So it's really bloody.
I have to watch it. I didn't watch it.
And then the second thing is, I agree with you. The results are not that impressive.
I was shocked. I thought for sure they would be much more impressive. And in some, even when it was going back on the website itself, which is marketing, they're trying to market themselves.
Yeah.
And they with the before and after, there's the bar, whatever that's called, that scrolls before and after. And I'm like, wait, which is the before and which is the after? And that's a problem
really
when you
impressive.
can't. It's not.
When
On the younger, more youthful looking patients, the ones that look like they were in their 50s or maybe even 60s, it was a little more noticeable, a little tightening, but like that airbrushy look. But the ones that had significant wrinkling and jowling, I was like, which is, I couldn't tell.
I feel like it's got a lot of, it makes a lot of sense and it's got a lot of potential and I'm really excited about it getting to that point. And you wonder if if the next level of this would be like Elocore Neo, Elocore
coring
Neo,
and heating at the same time.
Exactly.
I was
you
just thinking
combine
that.
heating with the coring and now you get like a double whammy like Elocore Neo. So what they'll do is they'll put out Elocore and then like 6 months later come out with Elocore Neo and then you pay like 80 grand to upgrade your device.
We're so cynical. We're so cynical. I've been doing this so long.
There must be a way, like I think that they're going to find a way to maximize this technology because it makes a lot of sense. As a surgeon,
I agree.
I'm like, wow, that's a great idea. Why didn't I think of that? But in practice right now, it's not something that I would say, go and do it because the results just don't seem quite there yet to me.
I agree.
Yeah.
But based on those pictures, I agree.
Exactly.
But I do. The theory of like microcoring out tissue, just like what you do for a facelift, and then heating it, so then you get a bloodless. It cauterizes the blood vessels, so then you don't have the blood, and you're doing the double whammy of coring and
wonder
heating.
If you could do that,
right?
Yeah.
And then you have more of a bloodless field. If it's a heated cord,
let's trademark that.
I was just going to say, why are we talking about it? Why don't we go on a side note after this podcast? And
I think we'd get a nice letter from Elocore's attorney if we tried doing that.
We would do it, yes.
But I think that it's got a lot. I agree.
Potential.
I think it's a lot of potential.
Yeah.
So if you're thinking about doing a facelift, I don't think that this is the answer yet. But the hope is that in the next 5 to 10 years, maybe this is something for somebody who's like in their late 40s, maybe early 50s, and you've just got that, a little bit of droopiness, a little bit of jowling, and it's like, how do I get rid of that without getting the scars and undergoing that big surgery? I think this has definite potential.
Yeah. In all honesty, if you were demoing it or trying it, I want to try it on my neck. Like my neck is an area where you can't, you can't really do too much filler on your neck or whatever. And Botox and all these things I've tried and I do my microneedling.
Totally.
There's still some laxity there that it's not enough to do surgery, but I would love to try something like this even for my neck.
Well, here's another thing you probably would love to try. Women are getting labia puff surgery for a more youthful, voluminous vulvas.
No, thank you. That's a no, thank you for the record.
According to just listen first.
As a female, no, thank you. But I'm okay. Open
we
mind.
listen and we do not judge.
Amen.
Okay. According to 3 plastic surgeons who spoke to the Post, this is from the New York Post, women are plunking down thousands of dollars to give their deflated-looking labia a luxe upgrade. As women get older, or go through changes such as childbirth or menopause, their labia majora, the bigger lips on the outside, can thin and lose volume. Now some doctors are offering what they call labia puff procedures to combat that thinning, all in the name of making vulvas look younger. As people age, the volume of the labia majora tends to get a little bit thinner, causing the area to shrink and sometimes appear floppy. Miami-based plastic surgeon Dr. Adam Rubenstein told the Post. Adam's a good friend of mine, great plastic surgeon. He's out in Miami. So injecting the area with filler or transferring fat can add the volume that it is lacking. While in the past women got labiaplasty for trimmer, flatter genitals, with some calling it a, quote, Barbie vagina, gross, unquote. Gross from me. It's not Barbie vagina gross, but I said gross. Puffier labia actually signal youthfulness, according to the pros. Volume loss in your outer labia can start to happen in your 30s and beyond, said Dr. Bianca Molina, a New York-based plastic surgeon with a practice on Fifth Avenue. This is especially amplified in your perimenopause and menopause phases, when the loss of circulating estrogen causes deflation in your vaginal tissues and outer labia, which can be helped with this puffing procedure, which is super hot right now, she added. Super hot.
Super hot.
Fat grafting is more fragile as the tissue needs to survive, so you'll want to avoid trauma, whereas there's really no downtime with fillers, said Dr. Rubenstein. When it comes to filler, you can just inject it and the patient can go about their day. All right, so you're all wondering, how much does a labia puff procedure cost? Well, filler needs to be built conservatively, so the price is based on the cost of the syringe of filler plus the doctor's expertise, said Molina. Because this is a sensitive area, I charge around $3,000 to $5,000 for filler and $5,000 to $7,000 for fat grafting. So, Dr. Levin, have you had anybody call asking for the labia puff procedure?
I have not.
No?
No, but I...
Do you
I
do
don't know
that?
how. I
Should
have
people
so
start
much to
calling the
say.
office asking for labia puff now that we've discussed it?
Okay, I will. I'm going to play the diplomatic response. I would say, listen, we're a fan of anything that makes you feel better about yourself. Is truly, to each their own. We listen, we don't judge. And if this is something that would make you feel better about yourself, we would have a conversation about it if it's something you're interested in.
Yeah.
That being said, ouch, number one, ouch. Like it doesn't when we do fillers on the face and other areas of the body, hands, we put numbing cream on and it still hurts a little bit.
Yeah.
So ouch, that's a tough one, as a female, that thought in my head is an ouch. But at some point, why is sort of my question. And, it to me, it borders a body dysmorphic disorder or a self-esteem issue or whatever is the underlying reason for potentially wanting. First of all, I don't know. We grew up with camel toe and people not wanting to see camel toe, which is, where you can see the labia through workout pants and things like that. People wanted to get rid of camel toe. So now all of a sudden people want, because it even mentions in that article, people feel better in their workout gear. They can, look smoother and whatever. It feels trendy. It feels like really getting to the core of why somebody would want that. And is there something going on? Does their partner want them to have that? Is there something, it did bring up that some women reported increased sexual satisfaction and, physically I'm trying to think of how that could happen, but I just listen, we could have a conversation about it. I'm open-minded. And if you are a patient that is interested in that, I'm willing to listen, but it would, we'd have to have a conversation if it's really a good thing for you or not.
Yeah. And
how do you feel about it? I don't know.
I agree. I don't operate in that down there. I know there's some surgeons who do, and it's not my thing, but I'm not one to judge anybody.
Right.
I wouldn't judge anybody if you want something like that done. If you look down there and like, hey, aging has changed how I look down there, and I'm thinking of getting some filler or fat grafting or something like that. I myself don't do it because I don't feel comfortable doing it. I just don't. I don't like being down there operating and stuff. Yeah. But hey, if somebody wants that and there's a good doctor who's, experienced with it and comfortable doing it, then by all means. I think the thing with the labia puff surgery and the article is I wouldn't necessarily go out advertising it though, especially as a male. It's kind of like, hey, have you had your labia puff today? That's just kind of.
I know it's something ooey about it. I know
it's kind of ew. So it's not my deal, but I think it is a real thing. I have had patients ask me about those areas and stuff. When I do tummy tucks, sometimes patients will ask me for a little lipo in that area or fat grafting. Not common. They ask for that, but I could see if you see those changes and you want to do that, then hey, talk to a plastic surgeon, talk to a dermatologist, and maybe they'll feel comfortable doing it. I think there's safe ways to do it. But at the same time, it's a little ooh to be making up a marketing gimmick term for it and trying to be like, hey, let's talk about it. Now, I know Dr. Adam Rubenstein in this article. He's a really good guy, straight shooter, great plastic surgeon. So I wouldn't judge him at all. But yeah, it's not my thing.
Yeah. I mean, the bottom line is with fillers, right? They're so wonderfully versatile. You can put them in anywhere, know, and I've had patients requesting scars or fat.
Yeah,
you know,
it's your own tissue.
Right. If there is something that is, you have skin laxity or loss of volume or, indentation, whatever, we can put them anywhere. And I've had interesting requests all over the body.
Yeah.
From belly buttons to, little just divoted scars to whatever. There's, But it is the labia puff.
Yeah.
I mean, you got to laugh and then ew.
Like, I think it does
the marketing of it.
If you're listening or watching today and you're actually like, well, maybe I would consider that. I've been thinking about it. I do think it can be done safely and effectively. I think fat, it's in general should be a very safe procedure. Just make sure you see somebody who's really experienced with it.
With fillers in general,
and that they know what they're doing. Whether it's filler or fat, make sure that they know what they're doing.
I mean, I would say, again, this is a scenario where people always like, I don't do that procedure. I've never done that procedure myself, and I've never injected filler. I do skin checks and excisions and surgical things in the genital area on both men and women. And, if you're experienced with filler, that's somebody you should go to that is experienced with filler, because it's not really unique as long as you know your anatomy and you're injecting it like you'd inject it anywhere else on the body. So as long as you know your anatomy and you go to someone's experienced with fillers and you have a reasonable reason to do it, then I think it's, reasonable.
Well, thank you so much for joining me today.
Thanks
so how can somebody learn more about Dr. Emily Levin? And if they are wanting to have your 4-in-1 or 5-in-1 Rosacea Fix Cream, how do they find you?
But not necessarily a labia puff.
But no,
not necessarily.
Dr. Rubenstein, Adam Rubenstein, Miami. He does a labia puff. Good guy.
Perfect. Call his office. Yes. You can find me. My website is www.nw-derm.com. I also have an Instagram channel and Facebook, which is northwestderm_covet med spa. And then I am in Bingham Farms, Michigan, if you're local and want to come see me in my office.
And we'll put a link to Dr. Levin's Instagram and her website in the caption of this podcast, so feel free to check that out. And I want to thank you so much, everybody, for watching and for listening. My name is Dr. Anthony Youn. This is the Doctor Youn Show. As always, if you enjoyed this podcast, if you can leave us a rating or review on iTunes or Spotify or wherever you get your podcasts, it definitely helps me spread the word. Otherwise, I'll leave you with this. Eat real food, use clean skincare, and auto-rejuvenate before you operate.